There is a nursing shortage across the country, and it could be critical to your care at local hospitals. News 2's Macy McLeod joins us from the Alert Center, and she has more on how this is actually happening right here in Charleston. Macy, what did you find out about the shortage?
Well, Carolyn, about 30% of nurses across the nation are at retirement age or older. And as these nurses begin to leave the field, there aren't enough new nurses to replace them. MUSC says they have a need for nurses in the operating room, critical care, and pediatric units.
So across the country, nursing schools are turning away qualified applicants.
One problem is there's not enough teachers to take on the demand for more nurses.
Having full-time qualified faculty is challenging. In fact, the salaries for nurses working in clinical settings has steadily increased in time, and the salaries for faculty have not.
MUSC's nursing school is trying to add as many students as they can.
We have increased our enrollment steadily over the past couple of years, and in fact, our January admissions went up by 10%. And so we are trying to accept more students, but we have to have the faculty and the clinical sites to balance that.
Another problem is only about 65% of nursing school graduates work in hospitals. Instead, they are opting for private offices and clinics.
Those positions may have better hours, may not have weekend responsibilities, or certainly not nights. And so the options for the graduating nurse have increased significantly.
And in the end, it could mean more dangerous hospitals for patients.
Once you become understaffed, those nurses work harder, and that's when mistakes can happen. And so it becomes a negative spiral that everyone wants to avoid because patient care is what we're about.
And she tells me they are trying to combat the shortage by emphasizing to nursing students the continued education benefits that can come by working at a hospital like MUSC. Live in the Alert Center, Macy McLeod, News 2.